As we come to the end of another busy month here at the Trust, I'm pleased to bring you a roundup of this month's stories. We kicked off June with a look at the new staff and patient CPR kiosks here at the Trust. And here's Ben McKay, Education Manager, and Eve Flockton, Resuscitation Training Lead, to tell us about the newly introduced CPR kiosks and their importance in encouraging everyone to learn this life-saving skill.
CPR stands for cardiopulmonary resuscitation. Effectively, somebody goes into cardiac arrest when their heart stops. So cardiopulmonary resuscitation is where we would place the hands on somebody's chest and artificially pump that heart, keeping those vital organs alive. We've purchased a CPR kiosk where anybody, literally anybody, can come into the hospital and have a go with the mannequin. We'll have a video on loop, so it will prompt and provide that training that you need.
The patient's kiosk is enclosed and would be hands-only CPR. And then within the staff module, it's going to be able to monitor the quality of rescue breaths, monitor the quality of the CPR, hopefully building confidence for when they need to translate that theory into practice.
Being a teaching hospital, we want to educate all. So that's why we decided to get the public access kiosk so that public can have a go too.
Thank you, Ben and Eve. This month, we also took a look at the Healthy Minds initiative. Spearheaded by Bradford District and Craven Health and Care Partnership, the initiative aims to improve mental health and wellbeing for communities in and around Bradford.
Our key ambition through Healthy Minds is how do we make sure that everybody who lives in Bradford has the opportunity to a better life. We've got lots of challenges in terms of people's employment, access to resources. We can't do any of this without our partners and without our communities.
What we're trying to do today is really look at how we're going to make the biggest impact. It's trying to make Bradford more equitable in terms of people's mental health.
So the Take the Mic night was a really good example of young people being able to share in their own words their experiences of mental health.
Pain's a pain, but pain's a human trait. Emotions are hard, but are part of what make us great. Remember, each day is a clean slate. It's better that you showed up and to do it late. I'm never good with conclusions, I guess it's a metaphor. We know the past, but not at all what we have in store. Thanks for listening, thanks for sticking with me. Remember, when things get tricky, growth isn't always pretty. Thank you.
That's what we want to really see a lot more of, people being able to share their experiences, build the types of services that we want to see for people across our district, and have people see people who reflect them, who represent and resonate with them. And that's why the partnerships with our voluntary sector organisations are so important, because they help really bridge that gap.
Thank you, Sasha, Mazira, and all of the team at the partnership. For the podcast this month, I had the pleasure of sitting down with Jamilla Hussain, consultant in palliative medicine and senior research fellow, and Victoria Ali, lead nurse for Palliative Care, to discuss their work here at the Trust and to give us an insight into the work of the Palliative Care team.
Ultimately, we have to bring the patient first, but what I think our team does that's brilliant is we don't just focus on the patient. We understand their interaction with their family and their community is fundamental. So us just saying, well, this is what the patient wants, we've got to ignore everything else, does a disservice actually to that patient, because they care about what's happening in their family and their perspectives. And that's one of the things I love about palliative care is it is about the family, it is about the wider community, it is about those relationships, and really focusing on that can make a huge difference.
Doing research with people who have a palliative diagnosis or who are at the end of their life can feel difficult. And I think what we can't do is kind of gatekeep those people's experiences to improve care. So I think it's absolutely vital that we're doing research within palliative care and we're providing a really strong evidence base for the care that we do. I'm interested in people's lived experience and the impact that has on how they access care. Knowing the humans that we're caring for is really important, and without doing research into that, we can't know that.
Thank you, Jamilla and Victoria. Finally, here's a look at some other exciting things that have been happening around the Trust this month. That's it for this month's update. I look forward to sharing more stories with you next month. Don't forget, all our latest news and updates can be found on our social media channels, X, formerly Twitter, LinkedIn and Facebook.